Gentleman from St. Louis County moves that we adopt the Conference Committee report to the Senate substitute for Senate Committee substitute for House Committee substitute for House Bill 2011. Gentleman from St. Louis County.
Thank you, Mr. Speaker. 2011, of course, is the Department of Social Services. This is where almost all of our Medicaid expenditures are. Some of the major new decision items. This year we did receive $50 million that we put into the budget because of the tobacco settlement refund of last Friday that released GR funding, which we used throughout the budget. We had a $2.2 million increase for the Children's Division Career Ladder to provide opportunities for advancement of experienced staff. $11 million and 23 FTA for the Children's Division for additional staff and a contract case management funding to address the increase in caseloads. $1.8 million for the Children's Division to help recruit and retain frontline staff. $10.3 million for the child care reinvestment. $560,000 for emergency shelter services. $48 million for adult dental benefits for the Medicaid eligibles, $10.8 million for primary care physician rate increases, $19.7 million for adult therapies benefits to current Medicaid eligibles, $2.5 million for a medical and behavioral health home for kids in foster care, $5.2 million for asthma education and in-home assessments, $12 million for a fraud and abuse prevention and detection system, $36 million for a long-term care rate increase, $59 million increase for managed care actuarial increases, $37 million increase for pharmacy PM increase, $58 million increase for Missouri Health Net cost to continue, $1.2 million increase for adoption resource centers, $500,000 for sexual assault services, and $1.4 million increase in funding for complex rehabilitation technology. Essentially, there was a lot of increases there. The Medicaid expenditures across the two bills, 10 and 11, and a little bit in 2, went up $360 million. Most of that was in adult dental and other therapies. The total budget that we spend on Medicaid in our budget this year is $9.3 billion. I'll take any questions from the body. Other than that, I renew my motion.
Money.
That's correct, lady. Yeah. It's part of this bill anyway. It's where the tobacco settlement money comes in and out of. So it was a natural place to put it, and we put it in the pharmacy line and
right.
The other line. What was the other line? All in pharmacy.
Right. And then the Utilacare, we didn't get everything we wanted, but we got the $4 million for that, and that'll be helpful, I think, combined with the LIHEAP funding. And
that's correct, lady. $4 million. It wasn't everything we asked for, but I've spoken to the people who are associated with that program. They're very happy with $4 million.
Yes, they are. And I just want to point out one of the most important things in here. They're all important, but I think the Children's Division funding is going to go a long way because that division has had problems with retention and morale, and I think that this is going to be very helpful, and I'm very pleased that we got this across the finish line.
That's a good point, lady. That's one of the most important parts of this budget.
It is. And you mentioned the primary care reimbursement. I'm very happy about that. It closes the gap between Medicare and Medicaid reimbursement.
That's correct. You're right, lady.
So I think that's it. You know, of course, I'm always disappointed that we didn't expand Medicaid, and that's not in here because all these good things could go so much further.
Right.
But
I understand, lady, and I appreciate your help on the budget. As some of the members know, you and I meet frequently during the process, and over the weekend we met for 3 hours at Caldy's in Kirkwood and went through all the conferenceable items. And it's been a great relationship that I've had with you on working on the budget. I appreciate your help and your demeanor in working on these budget items in areas that even we disagree on.
yeah, and likewise, gentlemen.
Thank you.
I'd like to echo the lady from Kirkton District sentiments about the importance of the additional funding and services that we provided for the Children's Division. And fortunately, the Senate added a internet-based health records for the foster children. So not only were we able to get through those mobility entities so that a caseworker could respond immediately to a potentially dangerous or certainly an uncomfortable situation for a child to be taken to safety. So, Mr. Speaker, that is significant, and I appreciate everything that we were able to do for the Children's Division. Mr. Speaker, I would again like to point out that we were able to accomplish some significant Medicaid reform in the forms of adult dental, adult rehab, the health homes for the children in foster care, and that asthma education. So we took existing Medicaid dollars that were in there and better directed them to existing Medicaid eligible recipients, who are those who, in my opinion, are in need of significant services and better ways of staying and even gaining back health. But I would like to caution the membership that what happened as we were identifying means to come up with certainly an example. One of the new decision items was the mental and behavioral health homes for kiddos in foster care. Actually, the representative from Hafner District and I first met with some individuals in St. Louis County last summer to hear about this potential pilot for health homes for foster children. And where we started off with a possible $250,000 program, and the amount went up as we went through the appropriations process. We did come back down to look at the $250,000 of GR, but the membership needs to recognize, in my opinion, that the drawdown was $2.25 million. So we received a 90-10 match for that funding. And that 90-10 match is only good for 8 quarters. So we're going to have some decisions along the way. I have encouraged the division as they develop this program, and they are looking for the implementation that we get the program going. I would expect that it will be a very efficient program, and as we move forward, be able to better fund it at less than what we're looking at right now, so that we don't have to cut this program spending down after 8 quarters when those federal dollars go away. Now, ideally, we see that we have a better economy. We have more going on in our state, and hopefully we will have more revenues coming in. But we need to recognize the cost of ongoing programs. So, it sounds good. We also had that same 90-10 match for the asthma education and the in-home assessments. And we know that throughout our budget, we have Obamacare-like matches. And yes, we are taking them, but they're not with us forever. And again, we will expect good outcomes, good metrics from the division as we move forward. So whatever happens 8 quarters from now, we will be able to do the right thing for those kiddos. With that, Mr. Speaker, I certainly hope that anyone who cares about people who really need help and services in the form of the Children's Division, in the form of the dual eligible groups for the age blind and disabled. I hope everyone who cares about doing better for those individuals will vote for this House Bill 2011. Thank you, Mr. Speaker.
Just like the budget chair said, and the ladies from both the Kirkton district and the Allen district said, there are many good things in these two bills. However, I'm very disappointed, just like the lady from the Kirkton district said, that the Medicaid expansion is not included. And do you share my disappointment, lady?
I absolutely share your disappointment and concern, and we heard about, several matches of 90-10, and with the expansion of Medicaid for this coming year and the following year, we would have had 100% match. The state would have just been allowed to provide services to people. Lady, I brought this card that shows us the federal poverty level, and as we decide how to vote once again on this bill, when we look at people who are earning between above 19% and below 100% of the federal poverty level, those people are left out in the cold with no health insurance because surely they're not making enough to afford it, and they're in a position where there is no subsidy from the federal government, there is no help from the state. Had we chosen to expand it, I'm just going to give you an example. A family of 3 at 100% of the federal poverty level is making $19,790. If they're making about a fifth of that, or 19% of the federal poverty level, so about $4,000, if they're making that amount of money or more, they are making too much under Missouri state law to be able to access Medicaid. So somebody who is, I have this horrendous cold, I'm stopping at the doctor on the way back home today, but people who are truly sick don't have a way to get to their doctor, so what are they going to do?
And the other thing about it that really bothers me is that almost all these people, I think up to 77% who would qualify for the Medicaid expansion, they're actually working people, but they work in very low-income jobs. It's not that they're out there, they are working hard, just like most of the rest of us Missourians are, but yet they make so little money that they either can't afford health insurance or their employer doesn't provide it for them, or even if their employer does, it costs too much and they can't pay for it. And these are the people we would be helping.
Right. And I've personally heard stories of people working 2 and 3 jobs, people working midnight shift. They're making minimum wage. As you said, they may have the ability to get health care if they can chip in to pay for part of it, and they're not able to do that. So you and I both know where they land. They land in the emergency rooms, not when they have a cold, but when they're very, very ill and need to be treated. And while we may not see that on our bills as direct costs to us, we are certainly indirectly paying for that.
Well, certainly, because it gets spread out to all the health insurance premiums to everybody else.
Right. So it's not just it's not just a fiscal issue. It's a moral issue. It says, do we care enough about our neighbors to make sure that when they are ill, that they have a place to go, that they have a doctor to visit, that they feel confident that they can go somewhere other than an emergency room? And
we will be losing almost $2 billion by not doing this, $2 billion that will go to other states, and $2 billion that could be used for those 300,000 hardworking Missourians, and that's just this year that we will lose those funds.
Right, and when you think about the fact that, through this budget bill and Budget Bill 10, we could have put into place Medicaid expansion, this would have been the biggest job creator that Missouri has seen. 24,000 jobs are predicted to be created in the first year of expansion alone, and we once again have continued to say no to it, and I'm not sure why. Do you recall all the organizations that have been supportive of the expansion of Medicaid for the state of Missouri?
Well, I know very unusual organizations that usually don't unite, like the Missouri Chamber of Commerce, the Missouri Hospital Association, the labor unions, religious leaders, all kinds of different healthcare organizations. All of these folks are in favor of the Medicaid expansion.
Right. So whether they're there because they believe it's fiscally the responsible thing to
Right.
do, whether they believe it's morally the right thing to do, for whatever reason we have this diverse these diverse groups of people that have come together, these organizations who have all said, yes, this is the year we need to do this. And yet the only group that I know of that's not supporting the expansion are my colleagues on the other side of the aisle
Exactly.
in the House and the Senate. And really, I haven't heard good rationale for it. Have you?
No, and I know, lady, you're on the Health Insurance Committee, and
Right.
you, along with the lady from the Gardner District, the McNeil District, and the gentleman from the Mollendorf District, just passed our first ever affirmative vote on Medicaid expansion. And it actually did include reforms, too, which is what I thought our colleagues on the other side of the aisle said they wanted. It had true Medicaid expansion up to the 138% of the federal poverty level, but it also had reforms in it. And so, but I'm not sure where that's going to go this year.
I'm not sure either, but I'm certainly hopeful we'll have an opportunity to move those bills to the floor for a full-blown discussion on
I do
them.
too.
You know, lady, we've seen in states that are largely run by, Republican legislators, Republican governors. They have ways, if the concern is that the federal government won't live up to its end of the bargain, they have these opt-out provisions that, you know, certainly we're going in with a promise and a commitment to the people, to the state of Missouri, that the federal government will be in there at 100%. Well, every day that we don't pass this, we're losing another day of that 100% opportunity.
Exactly.
But for us, for the next 2 years, were we to pass it this year, and then tapering down to 90% in 2021, I believe, is
Right,
the year.
2021, that's right.
And if at any point along the way we felt that the federal government wasn't living up to its end of the bargain, we could create a pathway to opt out should that be the case.
And lady, I actually think that's been in every bill that's been submitted so far, that there's something that says if the federal government reneges, if they don't fulfill their end of the bargain, then we will discontinue the program. I think that's been in every bill, whether it's been the majority or minority party that has presented it.
Right. So again, we have this opportunity to 260 to 300,000 Missourians who need access to health care, who aren't getting it, who are working people making so little money in the state of Missouri, between 19 and 100% of the federal poverty level, that cannot find a way to
Exactly.
afford to access health care in our state. So, you know, you and I are paying for it when they do need to end up in the emergency room. But meantime, we had this opportunity here to expand job creation in our state, good paying jobs, to bring billions of dollars into the state over the next
Right.
decade.
I
Billions
think
of dollars
it's like
infused
$8 or $9 billion.
Right, infused into this economy that we've turned our backs on. We've said we care about people. We've put things in this bill that say we want people to have access, but unlike other bills where people in the legislature seem to know people, so they want to make sure people with certain kinds of disabilities, for example, are taken care of, maybe we just don't know enough people that fall into these 19 to 100% of the federal poverty level categories, because I believe if we did, we would say, gosh, we've got your backs. You may not have something physically that shows up that we can see you need our help, but clearly you're working hard, you have a family to take care of. The moral thing to do would be to provide you with access to health care so that when you and your family need it, it is there for you. We are there for you. We want you to continue to be a productive citizen. We want you to be able to live a healthy, fulfilled life. And this is one opportunity we have to do this year.
And we haven't even talked about the hospitals and the pressure they're under with this, with the loss of the disproportionate share payments. We know that hospitals in Missouri have already cut 1,000 jobs as a result of not getting those payments. So there's so many tentacles to this that hurt us.
That's right. That's such an important part you brought up, because in a few years what we will see happen is that the federal government will not be paying the hospitals for the indigent care that they're doing, because there was an expectation that we would expand Medicaid, which would allow those poorer patients to go to the hospitals with insurance. So when they are not reimbursed, when the hospitals quit becoming reimbursed for taking care of these poor patients, first of all, I don't know where the poor patients will go, particularly when the hospitals in some of our rural areas begin to close because they don't have the same network that some of our larger
Right.
hospitals where you live in Kansas City and where I live
Right.
in St. Louis.
In fact, those rural hospitals are probably going to be hurt worse than the ones in the urban hospitals
Right.
by
And
these
then
things.
what happens to a person when he or she gets sick? When their rural hospital is closed in a few years, where are they going to go? They're going to have to travel 100 miles, 50 miles, 100 miles to come to a hospital in one of our areas. Well, you and I know that when you're very ill, that's not a good situation to be in.
Definitely. Well, thank you, lady, for the inquiry.
Thank you for the inquiry.
Mr. Speaker,
Yes, lady.
just to speak briefly on the bill.
Please proceed.
Thank you, Mr. Speaker. I'm very disappointed that Medicaid expansion dollars are not in either House Bill 10 or 11. I do believe, though, one day the General Assembly will wise up and will rise up and we will vote for Medicaid expansion. I just wished it were sooner than later, and that's why I will be voting no on this bill. Thank you, Mr. Speaker.
You know, I've been listening to the explanation that we just heard on the other side, and I just feel obligated to give the body the impression that I have as a practicing physician. You know, Medicaid is really not what it's cracked up to be. It does not really serve the recipients very well at all. In fact, there are some studies that indicate that the outcomes for patients that are on Medicaid are not even as good as those patients who have no insurance at all. In addition, there was a project in Oregon where they expanded Medicaid. They put 10,000 people randomly into an expanded Medicaid population, and they followed them for 2 years. At the end of 2 years, they tried to measure the improvement in physical health. There was no improvement. There was no improvement in cardiovascular disease, diabetes, stroke. There was no improvement in physical health. Although the visits to the ER spiked some 30 or 40%, and costs went up substantially. So an investment into a system that exists now, the way Medicaid exists now, is really not giving the taxpayers a good bang for their buck, and it's not giving the recipients good medical care. You know, another issue is that the current system reimburses providers very poorly. In fact, when I was in practice with some partners a number of years ago, the difficulty in obtaining your reimbursement from Medicaid and the paltry level of reimbursement when you did get reimbursed was so low we decided not even to submit a bill for Medicaid. We just provided the services. We couldn't write it off. You just forgot about it. Now, the idea that we are sending our taxpayers' dollars out of the state to go to some other place to enact or implement their Medicaid program, it just isn't true. For every dollar that we send to the federal government, we get $1.32 back from the federal government. So the tax dollars that Missouri is sending to Washington, they're taking all of that, giving it back to us, plus another 32%. Now, where do you think that comes from? It goes to the federal debt. So that money is coming from a Brinks truck on a slow boat from China filled with credit cards made out in the names of our kids and grandkids. I contend that's financial child abuse. That's immoral. If it's such a good idea, if our generation has such a good idea, shouldn't our generation pay for it? Is it right to really indenture our future generations with our good ideas? You know, let's put this in a little perspective. $2.2 billion, that money is not fallen from the sky. If the taxpayers of Missouri were having to foot this bill, this $2.2 billion divided among about 3 million taxpayers would amount to about $730 per taxpayer. You know, if you want to have a serious discussion about Medicaid expansion, somebody should propose asking the taxpayers if they want to foot the bill to that tune of $730 per taxpayer per year, and that's just the beginning. It'll ramp up substantially from there. But I'm not prepared to do that because I think the first thing we should do is improve Medicaid, improve the services. You know, another thing that hasn't been addressed with Obamacare, two major problems. First is liability. There's no effort to reduce the cost that is attributed to the out-of-control legal system that has made our liability such a burden to providers. The other is the fact that a third-party payer is paying for the cost of the health care, so that the individual recipient has no sort of sense of a proprietary feeling. They're spending somebody else's money. When you're spending somebody else's money, it's pretty easy just to say, run up the bill, give me the works, sky's the limit. My proposal for Medicaid reform would establish health savings accounts that would be funded, from which the recipient would be able to buy a high deductible plan and then pay with an EBT card out of their health savings account, and they would then have a more proprietary feel. They would have some buy-in, some skin in the game. There would be an incentive to save money, not to be, you know, spending sky's the limit. You'd be prudent with it the way you would if you were buying a used car or renting an apartment. You know, currently, patients that have serious illness or injury, they go to the emergency room and they get care. One of the reasons they get care is that we're cost shifting. That's why the aspirin tablet costs $5. But you know, there's a bright side to that, because we're not running up a debt. Everybody who's paying for health care, who can afford to pay for health care, is paying a higher cost for most items so that hospitals can afford to provide care for those who come who are indigent and can't pay for it. So at least we're not running up a debt while we're doing this. We're paying for it as we go. You know, another issue that's been raised is the idea of the dish payments. Now, we as the state of Missouri didn't do anything to diminish the dish payments. That came from the Affordable Care Act. And that amounts, at least in my hospital, I've kind of looked into it, fiscal year 2014, it amounts to about $310,000, $320,000. But you know what's a bigger financial hit to my hospital? And it's happening to hospitals across our state? Something called the RACS audits. It's labeled as detecting fraud and abuse. There's fraud and abuse, all right. It's our federal government abusing our individual hospitals. They are using minutia of coding irregularities, simple coding, call them mistakes, call them just, it's almost semantics. And it's not just that if you code the wrong thing, you get reimbursed at a lesser amount. If they catch you in this sort of clerical error, and that's what it really is, it's clerical error. They catch you in that, the entire amount of that hospitalization could be $30,000, could be $60,000. It all gets clawed back. And you know what drives that? The RACS auditors that are employed by the federal government are on a bounty system. They get a percentage of that. Now, it gets worse because so many of these auditors have made these claims of all this financial abuse, and when hospitals have appealed it, a great majority of them get overturned. But the administrative law judges that take on these appeals are overwhelmed now, to the point that they won't take on anymore. There are thousands of cases backed up. So our hospitals are being robbed, really, by this very badly run auditing process. And they don't have any opportunity to make their case to get the money back. That's something that should be addressed at our federal level. So it was the Affordable Care Act that reduced the dish payments. It is the federal government, used to be through Sebelius, don't know who the successor is, but it's that program that is immorally clawing back money from our hospitals. And it's, in my hospital, over the last 5 years, that was $8.5 million. So the dish payment reduction was about $310,000. And now, on top of that, 8.5 in the RACS audits. I think in Missouri, we're doing the proper thing right now. We're being fiscally conservative. We're looking at options to try to reform our Medicaid system, and that's how we should proceed now. Thank you, Mr. Speaker.
Mr. Speaker, we've heard about some things that are not in this bill, and I agree with my colleagues. I wish that there were some things in this bill, but today I rise to talk about the things that are in the bill. And there are times when I'm going to vote no on stuff, but in this, shocking, I get it, but sometimes I vote no. And that's because of things that are in it, not because of things that aren't in it. What's in this bill, what we've got right now, is I'm going to talk about the Children's Division. What we've got is the perfect intersection of leadership at the executive level with the new Children's Division Director, and then intersecting with a newfound investment from the legislative branch with the lady from the Allen District and the gentleman from the Stream District, investing the necessary resources in Director Decker, who came to us from the Division of Youth Services. He was nationally recognized for his work on turning that division around and making it a model for the way other states operate their DYS systems. Now we're lucky to have him in the Children's Division. There's work that needs to be done there. But what we have in this budget, at the same time as we have the leadership of the new Children's Division directors, we have a confluence of really wonderful things happening for children. And so while there are things that are not in this budget that are unfortunate, there are people who this budget significantly impacts, that it's going to make a great big difference in their lives. And for those reasons, I'm going to vote yes on this and really appreciate the leadership of the Budget Chair and the Appropriations Chairman. And as always, you're still looking good up there, Mr. Speaker. Thank you.
There are obviously a lot of reasons to discuss the Medicaid issue, but I wanted to point something out. A lot of times people feel like what we do in this building doesn't really make a difference. I was literally sitting in my desk listening to the debate on Medicaid, and I decided to go to the website of my hometown newspaper, the Columbia Tribune. And literally while we're talking about Medicaid, I read an article about nurses in my district who are taking a pay cut at our local hospital. They're literally cutting nurses' pay while we sit here and discuss whether we should reimburse the hospital, or whether we should expand Medicaid or not. I don't know if you guys have watched nurses work recently, but they work hard. I would say that they work a lot harder than we do in this building. And they're the ones taking a pay cut. And that's really bothersome. It really, because when you read an article about that, you want to say, man, I wish there was something I could do. I wish I could do something to help those nurses, keep their wages. And then all of a sudden you realize, wait, yeah, there is something we can do. We're talking about it right now on the House floor. 3 days ago, I had lunch with the hospital executive who was talking about the hospital in Boonville, right down the road from me, and they're talking about pretty substantial layoffs there. And he said a lot of it's due to Medicaid. While we sit here talking, they are literally laying people off. They are literally cutting the wages of hardworking Missourians because we're failing to act. Now, a couple days ago, all we were talking about was economic development and job growth, and we got a tax cut was going to get people to spend money. Well, these nurses are going to spend a lot less money with this pay cut, and that's something we know for sure, and that's not something that we're projecting in the future. That's something that's happening today. There are dozens of reasons. There are moral reasons. There are economic reasons. There are healthcare reasons that we should do this. But when you're sitting there watching people in your community lose money because the General Assembly is failing to act, it's incredibly frustrating, and you have to say something. So don't come talk to me about economic development. Don't come talk to me about how we're going to stimulate the economy and we're going to get consumers spending money, and then turn around and ask the nurses in my district to take a pay cut. Don't do that.
Since last June, I traveled all around the state of Missouri dealing with this issue, and time again, testimony over and over again wasn't just simply expanding Medicaid. It was a combination, and it is unfortunate that we haven't done something this year. However, I think moving forward next year, hopefully we can continue to push the ball forward, even though states, Mitch Daniels of Indiana pushed the poverty level up to 200%. Rick Perry of Texas, 185%. Governor Blunt from this state suggested 185%. We're simply trying to just get it to 100%. Whether you think the Affordable Care Act is the greatest thing since sliced bread or you think it's a train wreck, it's the law of the land. And we in Missouri have a chance to make a bad law a little bit better. And I hope in the future we will take that opportunity to actually act on that and make a poor law better and help Missourians across the country. The plan that I presented, 1901, is the most conservative plan to date in the 50 years of Medicaid. The most conservative plan in the country. I ask that we keep an open mind when discussing this issue in the future, whether it's tomorrow or next year or down the road, because it is important that we deal with this issue. At some point in time, it's going to become law. So why not sooner than later? Why not help those folks that are working? The mom that works 2 jobs and has 2 kids but can't afford health care. We should help them. We should. We come down here. I came down here. I made a promise to my boys I would look out for the underdogs. We should do that. When someone is trying to help themselves, why not try and help them also along the way? There is a wonderful opportunity here to do something. Mr. Speaker, I hope at some point in time, while I'm in this General Assembly still, that we act on that. Thank you so much.
I would just like to thank the Appropriations Chair for this committee and all the members of that committee. They have spent the last 2 years, actually 4 years in some cases, looking very diligently at the portion of our budget that consumes 45% of the expenditures in our state budget. And they've found a lot of places where money could be saved for a variety of reasons. And they've turned that money around and put it into places in our budget that I went through at the beginning of this budget discussion on this bill, where we have funded programs for the most vulnerable in our population. That was all done without taking additional money or expansion, but it was done by us looking at our own budget and finding ways that we could save money and spend it more wisely. That's the job that we have in the Missouri legislature, to look at our budget and find ways that we can spend the money in a better way. So with that, Mr. Speaker, I renew my motion.
The gentleman from St. Louis County has moved to third read and pass the Conference Committee substitute for Senate substitute for Senate Committee substitute for House Committee substitute for House Bill 2011. Mr. Kirk, please close the board and tally the vote. By your vote of 104 yes, 45 no, you have third read and passed Conference Committee substitute for Senate Committee substitute for House Bill 2011.